Hello and welcome to this video around Unit 8, Promoting Health and Safety in the Workplace. So you can see on here, health and safety is one of the fundamental important units within health and social care. You will have done your online learning and you will have looked at this through the care certificate and completed several other qualifications alongside this, such as food safety, moving and handling, fire, infection control, and so on. It's really important that you understand your role around health and safety and promoting your well-being at work. And remember, there's going to be conflicts here, and there's going to be certain times when people are going to ask you to do things, and your duty of care will simply be not to, because obviously it's not safe and safety at work. So let's look at what we've got. So the first one is about understanding your own roles and responsibilities relating to health and safety. So you need to identify relevant legislation within health and safety in the care setting. So we know we've got Health and Safety at Work Act 1974, we've got the Welfare at Work Acts, we've got moving and handling legislations, we've got COSH, Controls of Substance Hazardous Health, and we have RIDDLE, Reportings of Injuries, Dangerous Disease and Damage Regulation. Further down, you will see other lists of legislations that's relevant for you. Here, because it asks you to identify, you just need to list what they are. The next one, 1.2, wants you to explain the main points here of health and safety policies and procedures. So again, we have our policies and procedures online where you can go and have a look at them, and they're going to be in your staff handbook. Ideally, the main points of the health and safety policy and procedures are that you work in a safe environment and that you have a duty of care to record and report anything that you see that may be dangerous or put yourself or others in harm's way. You need to work in line with risk assessments, and you need to ensure that you're not doing things which puts people at risk, so you're using the correct PPE and methods of working. Equally, you're going to ensure things such as hoists or anything that's electrical are PAT tested, so portable appliance tested, and that they're regularly checked to be in good working order. 1.3 wants you to analyse the main points of health and safety responsibilities. So let's start with yourself. So you have a duty of care in law to report when you're not feeling well. Obviously, if you're not feeling well, you're not going to be working at your optimum level. It's important that you look after yourself, so you're not turning up to work under the influence of substances, and normally you have to be free from alcohol for about 8 hours before going on to a shift. You need to make sure that you're well, so in other words, you're not tired or fatigued, because when you're tired or fatigued, you can make mistakes. And again, your employer won't necessarily know that unless you've told them. You have a duty of care to report things. So if you see something and you feel that it may be putting you at risk or others at risk, you have a duty of care to report. You also have a duty of care to report near misses. So that's when we do something and we almost have an accident, but not quite. And again, near misses could be the start of something and people being avoided for causing injury or harm. So let's look at the employer and the manager's responsibilities. Well, they have roughly the same as yours, but they have a few more on top. So they have to provide you with adequate training. So if you're doing this MVQ, they're meeting that requirement. They have to provide you with the right resources to perform your job roles, so PPE, personal protective equipment. They have to ensure that you're having adequate rest between shifts, and that they're not overworking you in a way which puts you at risk. They have to ensure that the building's risk assessed and that you have policies and procedures, and that risk assessments are in place for undertaking tasks. So your employer and managers have a massive responsibility, but it only works if you're working with them and not against them. And then in other work settings, we have a responsibility to ensure that we have the right insurances, that we know our fire exits, that we know different procedures, and we know how to report those in different work environments. Again, if you're going to other people's homes or different buildings, it's important you know your fire routes, because again, that's for you to use in the case of an emergency or evacuation. 1.4 looks at specific training for tasks in which you must have. So we know things in health and social care, there's constant training, things around fire, medication, moving and handling, first aid. But there are other tasks in which you would need specific training for, things such as peg feeding, tracheotomy, catheter care, wound management, and clinical skills. It's important that we don't carry out any task unless we have been trained to do so. We know that we should be trained in controls of substances hazardous to health, COSH. If items around cleaning, because there are certain chemicals that shouldn't be cleaned with others. So it's important that you read the list of special training before you undertake any of those tasks at work. Number 2 looks at the responsibilities for health and safety and use policies, procedures, and agreed ways of working. So for this, you should be able to say that you go online, you can download the policies, procedures, and you follow those. So policies gives us an idea around how it links to legislation and why we're doing it. The procedures tell us how to do it, the methodology, the way in which to work. 2.2 is about supporting others to understand health and safety and agreed safe practices. So again, here you could talk about a time when maybe you've told somebody how to do something safely. Maybe you've shown them how to hand wash correctly. Maybe you've told them about removing PPE and where to put the clinical waste. Or alternatively, it could be a very simple task, such as maybe you've told somebody about health and safety for moving and handling. But it's important that when we give instructions and we tell somebody what to do, we tell them where to find the resources. There's a great phrase about if you give a man some money to go and buy some food for his family, it'll happen on that one occasion. But if you give them the fishing rod, he can go fishing for his family and feed his family for life. That's the same with knowledge. You could tell somebody to do something, and the reality is they may remember, or it may go in one ear and out the other. However, if you show them where they can find the answers and show them where the procedures are, then you feed them for life. They have a much better understanding, and they can pass that knowledge forward as well. And then it's not just, oh, but I was told to. It's, I know I must do this. I've read the policies. I've read the procedures. 2.4 looks at, 2.3 about monitoring potential health and safety risk assessment. So we must monitor the potential to cause harm, or somewhere in we may have a risk. So we do those from near misses or from accidents and incident reports. So for example, if I'm in a place of work and I've tripped over a loose bit of carpet, I haven't injured myself, but there is a risk there, and maybe the next person that trips up there will injure themselves. So there's a potential risk that needs to be addressed. That works out the same for accidents. It may be the fact that 3 people have cut themselves open in a box. Therefore, what that says is maybe we need more training around how to open boxes safely. We use data to manage potential risk and potential health and safety issues. 2.4 looks at using risk assessment in relation to health and safety. So risk assessments happen in 5 stages. We identify what the problem is, we look at who potentially could be harmed, we look at how we can reduce that risk, we look at the equipment we need, and then we come up with the safe ways of working to minimise the hazard or potential risk. So for example, let's think about walking a customer up and down some stairs. If you enter the stairwell with a customer and they fall, you're going to fall with them, so it's not safe. We can remove that risk of you falling by you simply not doing the task, or by installing a chairlift. So if there is a risk of you being harmed, then we wouldn't want you to undertake the task. So what could we do to remove that task? Well, we could go upstairs, we could take some pictures and come down and show the customer, say, well, look, what did you want from your room? Saving them going up to do it. Or alternatively, we could bring all their furniture down and they could live in their front room, and they have a macro environment to live in, meaning we remove the stairs altogether. Sometimes you can't avoid a hazard, and therefore we have to find other ways of working. So if you do feel that you're working in an area with a potential risk or a potential hazard, you have a duty of care to report this. And again, you can report it online following the incident report forms. 2.6 is about accessing additional supporting information related to health and safety. So here, you could talk about your health and safety poster. It's a legal requirement that they're displayed in all places of work. On here, it tells you who the health and safety executive is, who your health and safety officer is, and other ways of contact. Number 3, understanding procedures and responding to accidents or sudden illnesses. So here, we need to know the differences between an accident and an illness. So an accident is when an unknown factor happens and there is a potential to cause harm to yourself. So it was unplanned, it's an unplanned event. Meaning, if I was to trip up and fall over, that was an accident and I may cause an injury to maybe my back or my shoulders. Sudden illnesses come from being unwell or clinically unwell. So that may be things around asthma, diabetes, epilepsy. And again, we would have a good understanding around people's health. So therefore, it's important that you know the difference between an accident and an illness. The reality is, in our place of work in healthcare settings, we could have all different types of accidents and all different types of sudden illnesses. The sudden illnesses with staff, however, we should have a relatively good grasp of those because we do have questionnaires and we're aware of the types of illnesses that take place. However, that doesn't necessarily stop the accidents. So what type of accidents can we have in a care setting? Slips, trips and falls, moving and handling, cutting ourselves, or maybe accidental poisoning through overdosing a person. 3.2 looks at the procedures in which we should follow if an accident or sudden illness should occur. You will have all done your first aid training and you would have all done your basic life support. So we know that we have a triage treatment for the 4 Bs, breathing, bleeding, bones and burns. And therefore, all accidents and illnesses, we would follow the triage system. You were all taught about primary surveys and conducting secondary surveys. Therefore, you should have a good insight around how to deal with accidents and sudden illnesses at work. What you need to be aware of is the recording and reporting of those. Again, all of those are done online. So number 4, be able to reduce the spread of infection. So during your induction training, you will have learned about infection control. You will have also done your infection control e-module and you did infection control during your care certificate. Therefore, you should be able to walk through this section without any problems. However, let's just review it. 4.1 is about explaining your own roles in supporting and the reduction of spread of infections. So therefore, part of my role is to make sure that I'm not going to work if I feel unwell. I need to ensure that I follow universal infection control procedures. So good hand washing, wearing my PPE, and wearing the right PPE at the right times. About using good hand washing techniques. And again, you would have all done your hand washing training and you would have done that in your induction as well. Ensuring that I use alcohol gels or sanitizers as and when appropriate. And about learning to clean and decontaminate correctly, so I'm not throwing clinical waste items on the floor or cross-infecting as unnecessary. I know that my hair should be tied back. I know I should have minimal jewelry, I should have short nails, and I shouldn't be, and if I need to cough or sneeze, I do that into my shoulder or into a tissue. 4.2, describe the causes and spreads of infection. If you remember rightly, through all of the training that you've had, we know that we can spread infection by airborne, so coughing and sneezing, therefore good respiratory hygiene is important, so into a hanky or into your shoulder, or through poor hand washing and transmissions. So again, we know viruses can stay on work areas for up to 3 days. So good cleaning and decontamination techniques are important. 4.3, you need to demonstrate the use of personal protective equipment, PPE. So for this, we will have seen you on many occasions putting your gloves on, putting your aprons on, face masks, etc. It's important that you can demonstrate how to do this correctly. And when you take your gloves off, you're taking them off one at a time, you're putting them in the apron, and you're binning the whole lot in one go. 4.4 is about hand washing. And again, you will have all demonstrated in your induction training the correct process for hand washing. So it doesn't alter from level 2 right up to level 6. Hand washing is hand washing. We must follow the 7 stages and ensuring that we're using the correct way. Now, some of you during your training will have used the green gel on your hands to see what the bacteria and viruses look like. It's really important to make sure that you're washing deep in the grooves and across your nails. When we're washing, we're following those principles. 4.5 is about demonstrating ways to ensure that your own health and safety and hygiene does not pose risk to others. So for you to demonstrate this, we need to be aware about our own health and well-being. Therefore, if I'm not feeling well, if I feel that I have a temperature, if I feel that I have a cough or a sneeze, I should stay away from clinical areas. Maybe I need to wear a face mask if I'm sneezing. Could just be allergies, but again, I don't want to be spreading any virus or germ. It's important to know that if I've had diarrhea and vomiting, I should ideally go to my doctor and have a stool sample checked and make sure that I haven't got salmonella or food poisoning, because again, the bacteria can live in my bowels and I can pass those on through. So it's really important that I look after my own health and well-being. Number 5 is about moving and handling equipment and objects safely. Again, during your induction training, you were taught how to move and handle. You will have done your moving and handling training online. You would have done the practical, theory and assessment. So explain the main points of legislation relating to moving and handling is relatively straightforward. We know that we shouldn't be moving and handling equipment if it can be avoided. We know if we have to do moving and handling techniques, we need to be doing it for the least amount of time and the least amount of distance. We also know that we should have the correct equipment. So we should have so that could be trolleys or alternatively hoists. We know that we should have training in doing the task correctly, and that should be theory and practical. So explain the principles for safe moving and handling are relatively straightforward. We need to think about the ergonomics. So how many times we're bending and moving our body. We need to keep our back straight and we need to be bending our knees. 5.3 is about moving and handling equipment and other objects safely. So again, here you can discuss about how to move a box. You could state, if I was to move a task, I would test the weight first. Maybe I would kick the box, see if it moves. I would do a risk assessment. I would know my route. I would be able to see if I could pick the box up by myself or whether it's a 2-person. I could get a trolley and equipment. So all of the things that you've learned through moving and handling should be demonstrated through that. Number 6 is about being able to handle hazardous substances. The COSH controls the substance hazardous to health. Here, you need to describe different types of substances that may be found in a work setting. The reality is we have all of the chemicals that are normally found. We can have oxygen and combustible materials and flammable materials because of cylinders for oxygen. We have cleaning materials. We have some bleaches, so that's harmful to the environment and harmful to our skin. The reality is we know all hazardous materials should be in a locked cupboard. There should be a data sheet telling us what to do if we spill the chemical on us and what the first aid principles are. It's important that I know how to use those materials and cleaning equipment because they may be more hazardous to health and I may need to wear additional PPE. Maybe if I'm using bleaches and other chemicals, I might need to use gloves and face masks. So the safe practices when storing hazardous materials is simple. We need to make sure that the item's clean and it's not leaking. We need to make sure that it's stored in a dry area, away from the heat source, and we need to make sure that we're following the data sheet. When we're using the hazardous materials, we'll see the images, and again, you will have covered those images in your COSH training. We need to make sure that we're reading the data sheet on how to use the chemical correctly, and if we're having to dilute, we're aware of ratios, so the amount of cleaning chemical, water. And again, if we're disposing of hazardous materials, we're aware of how we're doing those. So again, normal waste in a normal bin, normally clinical waste goes into the yellow bin, soiled linen goes onto a red bag, and again, we're following the correct for dealing with those. Number 7 looks at ways of being able to promote fire safety in the work setting. So the first one here is about preventing fires from starting and spreading. So we know that to stop a fire from starting, it needs 3 things, the fire triangle. It needs a heat, it needs ignition, and it needs oxygen. So we want to avoid having anything built up around ignition points, so plug sockets or in kitchens or waste outside the house, so places where things can combust. We want to make sure that all equipment that we're using is in good working order. Therefore, things are pack tested, they're electrical tested. We know that they're not going to go up in flames. And then from spreading, we want to make sure that we do everything we can to reduce a fire from spreading. We don't have doors propped open, but they're done on the electrical system. So if a fire does start, the door will close. Again, we don't have lots of build-ups, and we can move freely from rubbish. So again, all rubbish should be away, and oxygen cylinders should be away from building. 7.2 is about demonstrating the measures that prevent fires from starting. So again, doing floor walks is a really important thing, or knowing at least the area in which you're working. Making sure that you could get to windows, making sure that you know where the fire alarms are, making sure that you know where all the heat sources are, that you know where the gas and the water mains are, so you know what to do in the case of fire. 7.3 is about explaining the emergency procedures to be followed in the event of a fire in a work setting. So normally, the first thing we would do is raise the alarm, if safe to do so. Now, it may be difficult for you to do that, so again, we can shout fire, fire, fire really loudly, or we would look for the red button, or maybe there's a smoke detector. So there's lots of different ways. If we're out and maybe we've got our phone, we could call the fire brigade. We know that in the case of a fire, fire extinguishers should be found at all fire exits, because the idea is the fire extinguisher is there for you to use against the door so you can get out. So if you do see your door being obstructed by a fire, make sure that you have the fire extinguishers is really important. Ensuring that your routes are clear at all times. So it's really important that you go around and do the floor walks, ensuring that it's safe. And again, if you see anything, you report it straight away. Number 8 is about implementing security measures in the work setting. So again, this one's always a bit difficult, especially in health and social care, because they're normally busy environments. But it's important that when you start work, you go around and you do a floor walk, making sure doors are closed, and we do a number count so we know how many people are in the building. It's important that we have a system for checking people in and out of the building. So if you've got volunteers or visitors, that they have a badge or a neck lanyard saying that they're visitors. And if they're not, and you're not sure who they are, then obviously approach them and ask them, how can you help? Your setting should have their own security procedures. So again, you should have policies and procedures for dealing with intruders, and it's important that we don't put ourselves at risk. So measures to protect your own security. If you felt that you were in a position, maybe you're on a night shift and you felt there was an intruder, you obviously have a duty of care for your residents and yourself. So it might be the case if you feel that you are unable to tackle the person, you put yourself to a place of safety and you call the police. However, it might be the case that you're confident enough to go up to somebody and ask, how can we help them? It may be that somebody's just got lost and they just need Equally, it's better off to do it in pairs. If there was another member of staff with you, you should go around together. 8.3 is about explaining the importance of ensuring about where people know about your whereabouts in the workplace. So, not that we want to keep an eye on everybody, but we do have a duty of care to know where you are at all times. So, in care homes, if there was an incident or an accident or an emergency, people would know where you are to find you. Equally, if you're alone working, it's important that you have a system for checking in and checking out of places, because we need to make sure that we know you're safe. Finally, number 9 is about managing stress. So it's important that you're able to identify when you're stressed, because you work with vulnerable people and you also become vulnerable. So it's important that you are able to identify common signs. It might be the fact that you're tired and fatigued. It might be that you're becoming more angry, short-tempered. It might be the fact that your pulse starts to increase. So you'll have physical signs and physiological signs. So things that you start seeing, maybe you're starting to. Physiological signs is your body, so maybe you're beginning to shake, maybe you're beginning to sweat, maybe you can feel your heart rate. 9.2 is about analysing factors that can trigger stress. So it's about understanding we all have our limits. There's a great phrase about the straw that breaks the camel's back. So it's important you're aware of different factors that can trigger you. So again, it could be things such as working under pressure. It could be the fact that you're in a stressful environment, and it's about recognising those factors that can. Because when you're aware of your triggers, you're able to do something about it. You can go outside, take 5 minutes, maybe get yourself a cup of tea, come back and be able to cope in a better environment. 9.3 is about your strategies in managing your stress. So again, what is it you're going to do when you find yourself in stressful situations? Some people find deep breathing helpful. Some people find talking helpful. Some people want to be on their own. Some people like to meditate. Some people like to listen to music. So whatever it is you do, think about how you can incorporate that in your place of work. And finally, 9.4 is explaining how to access support. So it's important to realise that we all have limits. We're all people, and health and social care is a demanding job, physically and mentally. It's important to know that actually we are able to go and talk to our supervisors and managers. It's important that we can get supervision to help us deal with our thoughts and feelings so we don't become overburdened. What we don't want to do is have stress turn into depression or any other mental health illness. So it's important we look after and manage our stress well. So let's just run through some of the learning outcomes that we've covered. So we understand our roles and responsibilities relating to health and safety. We looked at some general health and safety legislation from Health and Safety Work Act 1974, operating regulations, first aid regulations, RIDDLE and COSH. We looked at some of the policies and procedures. We looked at dealing with equipment. We talked about practices, what to do with emergency situations, things around food preparation and things around infection control. We talked about our own responsibilities into health and safety and the responsibilities of our managers and different tasks we're able to undertake. Learning outcome 2 was about carrying out our own responsibilities for health and safety. So here again was about accessing our policies and procedures and monitoring potential risks of harm. We identified things on risk assessment, so what risks are, how they're written, and we looked at the 5 steps of risk assessment, identifying who could be at harm, evaluating, reporting, and reviewing. In learning outcome 3, we talked about procedures for responding to accidents and sudden illnesses. We looked at accidents as maybe slips and falls, and we looked at injuries that could happen there. And we looked at sudden illnesses such as diabetes, epilepsy. We talked about the need to know how to look after ourselves and how to report those. And again, we've all done our first aid training, so we should be aware of our priority of life and how to conduct a primary survey. Number 4, we looked at about being able to reduce the spread of infections. We talked about our care certificate, we talked about our induction training, and we talked about really good hand washing here and wearing correct PPE at all times. Learning outcome 5 was about moving and handling equipment. So again, we talked about some of the basic regulations there, which was the moving and handling operations. We talked about the fact that you would have done your 3 online videos at practical assessment theory. We talked about the importance of ergonomics, and we talked about trying to do the task in the least amount of moves. So really planning and thinking about our moving and handling tasks before we need to do. Learning outcome 6, we talked about hazardous materials, so COSH, controls of substance hazardous to health. We talked about knowing what the chemicals were, we talked about the importance of reading the COSH data sheet, and we talked about the importance of making sure that that's correctly. In learning outcome 7, we talked about fire safety. So we talked about the fire triangle, and we talked about making sure that electric equipment was checked properly, and we did floor walks, we ensured that areas weren't built up with rubbish, and we knew how to raise the fire alarm and how to leave the building. The other thing that we didn't talk about in there is the personal emergency evacuation plans, the PEEPs. Every single person should have a PEEP, a personal emergency evacuation plan, on their care plans, and that will tell you on what to do in the case of a fire for that particular individual. Learning outcome 8 was about security measures. So again, keeping yourself safe, ensuring that the building is locked up, checking people in and out the building, and knowing who they are, and then confronting them. And finally, number 9, we talked about managing stress. So looking at common signs and symptoms, being aware of your physiological symptoms and the emotional. We talked about ways in which you could manage your stress, and we talked about ways that you can get support. At the end of this, there's a fair amount to recommend reading because there's a lot of subjects here, and you can see there you've got some books, and again there's a lot of websites at the back. Finally, the assessments for this unit is you need to download the workbook accompanying alongside this video, complete that and submit it. You will also have lots of recognition of prior learning, so you will have done lots of lots of other training. You'll have done your first aid training of illnesses and accidents, and your fire training, that covers fire. You've done your COSH data training, so that covers COSH. You've done your moving and handling, so that covers moving and handling. You've done mental health and stress awareness, so that covers the last outcome. So again, all of those certificates will be added in with your training. I hope you found this helpful. It's quite a busy unit, this one. I wish you all the best of luck, and I'll see you in the next videos.